So the Royal College of Paediatrics and Child Health is one of the big Royal Colleges, and our role is to ensure that doctors get the training and education they need to be good children's doctors. So what would I say to other Royal Colleges, or indeed people who are considering Surpass as a product? It's the future, it's what's going to provide a better exam for your candidates. It's going to be more real world. You're going to have an exam that replicates what you're trying to test. What Surpass provides us is that intuitive authorship experience. It allows people to interact with it in a way that they understand. Before they even use the product for the first time, they know that by clicking on this box, you're going to get the following output. But we're in a moment in time now where the expectation of anything that's delivered is that it will offer an intuitive experience for the user.
Previously, candidates had to mark a multiple choice card with their answers on, and often you would see by looking at a script a candidate had marked on the wrong row an answer, and then all subsequent answers would be incorrect, and there's nothing we can really do because they're the candidate answers. Whereas in Surpass, it's very clear for the candidates to see which answers they've given to which questions. They're able to flag and return to questions that they want to consider again before they submit their final answers. And also, we sent out a feedback form to all our candidates who sat our pilot exam, and 70% of those candidates actually preferred the exam delivered in Surpass and Secure Client rather than the previous written format.
Image quality is something that's really important to our candidates because all of us have different abilities to see things, and we're used to, in the clinical context, of being able to blow up and make images bigger and then make them smaller, particularly with things like X-rays. We want to make the exam as high fidelity as possible, as alike the real world as possible. A lot of time and effort was taken to improve that user experience. In the end, we've got something now that works and the candidates like and enjoy.
I think that the strategic possibilities that Surpass brings us in terms of enhanced feedback to candidates and looking at more data and the educational importance of some of the data we can now get, such as the amount of time candidates spend on individual questions, the amount of time they spend on the exam overall, can only help us but deliver a better enriched exam to candidates.
With the support of the Royal College of Paediatrics and Child Health Exams team, this has been a project that has blossomed. And we've finally got to the point where we're delivering it. We're delivering an exam that not only looks better, but feels better and is working well for the candidates, but also working for us as an organisation. Fundamentally, examinations are the cornerstone of everything for us as doctors. Assessment drives learning. By getting the assessment right, that we get the doctors that children need going forwards. BTL have been partners in that with us. It's a great journey that we're going on. We're improving something that's already really good, something that is recognised globally as being a world quality exam, and we're making it better. And the outcome from that is better outcomes for children. If that doesn't get us out of bed in the morning, then nothing will.